Your blood pressure pill might be telling you something your body can't ignore. Most people never connect these quiet signals to their medication, and missing the last two we discussed could genuinely be life-altering. Please don't skip ahead on this one. Before we dive in, let's get one thing straight. This isn't about creating fear. It's the exact opposite. It's about empowerment. So many of us are on a medication journey, and the conversation can feel very one-sided. We're handed a prescription, told it will help, and that's often where the discussion ends. But your body is in a constant conversation with you, and my goal today is simply to help you understand its language. Some people hear side effects and think all medication is bad, while others assume a widely used drug must be perfectly safe for everyone. The truth, as it so often is, lies right in the middle. True health management isn't about rejecting medicine or blindly accepting it. It's about creating a conscious partnership with your doctor. It's about knowing your own body well enough to say, hey, something feels different, so you can work together to find the safest, most effective path forward for you. You're about to learn about 12 of these signals, these whispers from your body that are tied to amlodipine. This information has been carefully researched, and everything is backed by sources you can find in the description. This isn't medical advice, it's educational fuel for a better, more informed conversation with your healthcare provider. Your health is your story, and you deserve to be its most empowered author. Let's begin. Visible swelling. Let's start with something you can actually see, something many people just brush off as a normal part of aging or a long day on their feet. Have you ever kicked off your shoes at the end of the day and noticed that your ankles or feet look, well, a little puffy? Maybe you see a faint line where your socks were digging in. For up to 15% of people taking amlodipine, this isn't just a random occurrence. It's a condition called peripheral edema. It happens because the medication is doing its primary job really well. It's relaxing and widening your blood vessels to lower your blood pressure. But in the process, it's almost like the plumbing has become a bit too relaxed. Tiny amounts of fluid can leak from your blood vessels into the surrounding tissue. Because of gravity, this fluid naturally pools in your lower legs, ankles, and feet, causing that noticeable swelling. It's often painless, but it can feel heavy, uncomfortable, and make your favorite shoes feel strangely tight. You might be wondering, does the dose matter? Absolutely. This is where self-awareness becomes so important. Research shows a clear connection. At the lowest dose, maybe only 2 out of 100 people will experience this. But when the dose is increased to the higher end, that number can jump to more than 1 in 10. It's a gradual change, something that might creep up over a few weeks after you start the medication. It's one of the most common side effects, yet so many people never make the connection. They just assume they ate too much salt or stood up for too long. Now let's talk about a different kind of swelling, one that isn't just a nuisance, but a potential medical emergency. It's called angioedema. This is rare, but it's crucial to know about. Unlike the slow, puffy swelling in your ankles, this is a rapid, deep swelling that can affect your face, your lips, your tongue, and most critically, your throat. Imagine waking up and one side of your lip feels strangely thick and firm, or your tongue suddenly feels too large for your mouth. This isn't a surface-level allergic rash. It's happening in the deeper layers of your skin and can escalate within minutes or hours. The danger here is obvious. If the swelling affects your airway, it can make it hard to breathe, swallow, or even speak. This is your body sounding a 5-alarm fire. It's an allergic type reaction where your system is being flooded with inflammatory signals, causing this dramatic fluid buildup. The most frightening part? It can happen to anyone at any time, even if you've been taking the medication for years without a single issue. If you ever experience this kind of sudden, asymmetrical swelling, especially around your face or mouth, it requires immediate medical attention. It's a perfect example of why knowing these possibilities isn't about fear. It's about being prepared to act decisively to protect your own life. One kind of swelling is a signal to have a conversation with your doctor. The other is a signal to call for help right away. Heart paradox. Here's where things get really counterintuitive. You take a pill to protect your heart, to lower your blood pressure, and reduce the risk of a heart attack. But for a small number of people, amlodipine can create a paradoxical effect, a strange twist where it can actually worsen chest pain or, in very rare cases, even trigger the very thing it's meant to prevent. This isn't the medication failing, it's a complex phenomenon that can happen when the medication is first started or when the dose is increased. It's sometimes called coronary steal syndrome, and it's a concept worth understanding. Imagine your heart's blood supply is a garden irrigation system with a network of hoses. If some of those hoses are already a bit old and narrow, representing arteries with some plaque buildup, they can't open up very wide. When you take amlodipine, it works on all the hoses, but it's most effective on the healthy, flexible ones, opening them up wide. This is a good thing overall, but it can create an imbalance. So much blood flow gets diverted down these newly widened, healthy paths that it can effectively steal blood flow and pressure from the areas of the heart served by those older, narrower arteries. That part of your heart muscle, which was already struggling for oxygen, suddenly gets even less. This can lead to increased angina, that familiar feeling of chest tightness or pain, or in the worst case scenario, a heart attack. It highlights how your body's response is incredibly unique and why close monitoring at the start of treatment is so important. Now, beyond this paradox, there's a more common cardiovascular effect: hypotension or blood pressure that drops too low too fast. We've all felt that head rush from standing up too quickly, where the room gets a little gray for a second. Imagine that feeling happening more often, with more intensity. This can lead to dizziness, lightheadedness, a sense of profound weakness, and in severe cases, fainting. For an older person, a sudden fall due to fainting isn't just a minor event. It can lead to fractures and serious injuries. Finally, we have to talk about rhythm. Your heart has a natural steady beat, a rhythm that keeps your life force pumping. Amlodipine can sometimes disrupt this rhythm, causing what are known as arrhythmias. It can go one of two ways. Your heart might slow down too much, a condition called bradycardia, leaving you feeling tired and weak. Or your body might overcompensate for the low blood pressure with something called reflex tachycardia, where your heart starts beating excessively fast, racing like a runaway train. This can feel like fluttering or palpitations in your chest and can be quite frightening. It's your body trying to maintain balance, but the result is a rhythm that's out of sync. All of these effects underscore a vital truth. A powerful medicine requires powerful self awareness. Nerve signals. Let's shift our focus from the circulatory system to your body's intricate communication network, your nerves. Think of your nervous system as the electrical wiring of your house, sending signals from your brain out to every last corner of your body. What happens when that wiring starts to fray? For some people on amlodipine, a condition called peripheral neuropathy can develop. It's damage to the nerves that are furthest from the center, out in your hands and feet. It often starts with a sensation that's easy to dismiss, maybe a subtle tingling like pins and needles in your fingertips or your toes. You might not even think anything of it, but over time, this can progress. The tingling might transform into a constant numbness, or for some, a burning, relentless pain. People describe it as feeling like their feet are on fire or being stabbed with tiny needles. This isn't just about discomfort, it profoundly impacts your life. When you lose sensation in your fingers, simple tasks like buttoning a shirt, picking up a coin, or even typing can become frustratingly difficult. When your feet are numb, your sense of balance is compromised. Your brain isn't getting the clear signals it needs to know where your feet are in space, which can make walking, especially in the dark or on uneven ground, feel precarious, increasing the risk of falls. The exact reason this happens isn't perfectly understood, but it seems to involve how the medication interacts with the calcium channels that are essential for normal nerve cell function. Recovery can be slow and sometimes incomplete, even after stopping the medication, which makes early recognition absolutely key. Now, there is another, much rarer neurological effect that can be even more distressing. It's known as extrapyramidal symptoms. This is a category of movement disorders that are usually associated with antipsychotic medications, so finding them linked to a blood pressure drug is surprising. This is where your brain's control over involuntary movement goes haywire. One of the most significant symptoms is called dystonia, where your muscles contract powerfully and uncontrollably, causing twisting, repetitive movements, or forcing your body into abnormal, often painful postures. It could be your neck muscles pulling your head to one side, or a cramp in your arm or leg that just won't release. Other people might experience a profound sense of inner restlessness, an inability to sit still, or tremors that happen when their body is at rest. It can even affect your eyes, causing them to roll upwards involuntarily. These symptoms are deeply frightening because it feels like you're losing control over your own body. Because it's so rare, it's often misdiagnosed as a primary neurological condition, not a medication side effect. This is the ultimate example of a silent problem, one that you would never think to connect back to your blood pressure pill unless someone had told you it was a possibility. Systemic stress. Your body has several key organs that work tirelessly in the background, like the unsung heroes of your internal world. But when a new substance is introduced, these systems can sometimes show signs of stress. Let's start with one of the most resilient and hardworking organs you have, your liver. Your liver is your body's master filtration plant, processing everything you consume. Although it's rare, amlodipine can cause hepatotoxicity, which is a fancy term for liver damage. It's a complication that can develop quite quickly. I've read documented cases where a patient starts the medication and within a week or two, they begin to feel a deep fatigue that sleep doesn't fix. They feel nauseous, have pain in their abdomen, and then they or their family members notice a yellowish tint to their skin and the whites of their eyes. This is jaundice, a telltale sign that the liver is struggling to process a substance called bilirubin. Lab tests in these cases show liver enzymes skyrocketing, a clear signal that liver cells are being damaged. The good news is that in most documented instances, when the medication is stopped immediately, the liver can heal and recover. But it's a stark reminder that even a safe drug can pose a serious risk to a small subset of individuals. This is your body sending a clear distress signal that the system is overloaded. Now let's talk about another place this stress can show up, your mouth, specifically your gums. A small percentage of users, particularly men, may develop a condition called gingival hyperplasia. This is a very distinctive overgrowth of your gum tissue. It usually starts subtly within the first few months of treatment. The tissue between your teeth starts to look a bit thicker, a little puffier. Over time, it can progress to the point where the gums become firm, fibrous, and begin to grow over the surface of the teeth. This creates functional problems. It's much harder to brush and floss effectively, which can lead to other dental issues. It can also interfere with chewing and even talking. But just as importantly, it has a cosmetic impact. When it affects your front teeth, it can make you feel self-conscious about your smile, affecting your confidence and quality of life. This happens because the medication can disrupt the normal balance of collagen production in your gums, leading to this excess tissue growth. Finally, let's look at your body's largest organ, your skin. Your skin is often a mirror, reflecting what's happening on the inside. Amlodipine can cause a wide range of skin rashes. The most common is a general rash with flat red spots mixed with raised bumps, which can be itchy and uncomfortable. But we have to acknowledge the most serious, though thankfully very rare, skin reactions. These are dermatological emergencies that require immediate care, where the skin and mucous membranes can begin to blister and peel. Early recognition of any unusual skin reaction and discussing it with your doctor is always the right call. Quality of life. This last chapter is about side effects that might not sound life-threatening on paper, but can fundamentally dismantle your quality of life. This might be the most important discussion of all, because these are the effects we are most likely to blame on stress, aging, or just having a bad week, rather than connecting them to our medication. Let's talk about your mind. Many patients report experiencing severe anxiety, deep depression, and volatile mood changes while on amlodipine. We're not talking about just feeling a little down or worried. We're talking about sudden, overwhelming panic attacks that seem to come from nowhere. Your heart racing, sweating, a feeling of absolute doom. It can be a level of anxiety that makes you afraid to leave your house or be in social situations. The depression can be just as profound, a persistent, heavy blanket of sadness, a complete loss of interest in the hobbies and people you once loved, feelings of worthlessness, and difficulty concentrating. This is especially insidious because if you're feeling this way, your first thought isn't going to be, I wonder if it's my blood pressure pill. You're more likely to think there is something wrong with you. It can strain relationships, impact your work, and steal your joy. Loved ones might notice personality changes, saying you seem more irritable or withdrawn. It creates a vicious cycle where poor sleep, another common issue, exacerbates the mood changes. This knowledge is power. It gives you a new lens through which to view your emotional health. Now let's connect mood to another sense, taste. Imagine sitting down to your favorite meal, the one that brings you comfort and joy. Now imagine it tasting like metal or bitter or like nothing at all. This condition is known as dysgeusia, and it's a rare but devastating side effect. It's a complete or severe alteration of your sense of taste. Food is so much more than fuel. It's culture, it's memory, it's connection. It's one of life's simple, reliable pleasures. When that is taken away, it can lead to a loss of appetite, unintended weight loss, and social isolation as you start to avoid meals with friends and family. It's another way the world can lose its color. Finally, let's talk about something incredibly common but rarely discussed in this context: constipation. Amlodipine works by relaxing smooth muscle tissue, and that includes the muscles in your intestines. By slowing everything down, it can lead to chronic constipation, which goes far beyond a little inconvenience. It can cause significant bloating, abdominal pain, and a constant feeling of being sluggish and uncomfortable. For older individuals, chronic straining can lead to other complications. This is the definition of a quality of life issue, something that subtly erodes your daily comfort and well being. Ultimately, this isn't a list to be afraid of. It is a map, it's a guide to help you listen more closely to the one expert who is with you 24/7, your own body. Your body is always communicating with you, sending you signals and whispers about how it's responding to the world around it and the substances within it. Our only job is to learn its language. This knowledge empowers you to walk into your doctor's office not as a passive recipient of care, but as an active, informed partner in your own health journey. True well being is found in that space of conscious awareness where you can blend the best of modern medicine with the timeless wisdom of your own intuition. Share this with someone you care about who needs to hear it.